Hello once again and welcome back to my YouTube channel. My name is Alotte and I am a physical therapist. In today's video, I am going to continue what we have started regarding the management for poor posture and some of the things that we can do to kind of like help ourselves to be more upright as possible, so we will not have to experience any pain from the neck, from the back, and into the shoulders. So in today's video, I am going to show you how we can support ourselves while we are seated, predominantly seated. Because like I said, when we are like slouching and we were trying to like correct ourselves, in no time we will be like, okay, I'm tired, I just want to slouch again. Or whether you are consciously knowing it or unconsciously, which is happening most of the time, because it's so comfortable being, having in that position. Things that you can do in order to be able to support ourselves as we started to try to correct and make ourselves a little bit more upright. By the way, if you are new to my channel, please consider subscribing, as most of the videos that I am posting is part of a series. And then you could also hit the notification bell so you won't miss any of those videos. So without further ado, let's just continue. Okay, the three things that I am talking about earlier is all about how to position ourselves in order for us to be more as upright as possible. Now the first thing that we are going to do, let me just turn this, okay, is we are going to find the most comfortable position, okay? And we call that the neutral spine, because if we are seated slouching, as I've said, the pelvis is pushed towards the back. So if we are trying to like push it a little bit more towards the front, it may not be too comfortable for some people who have been slouching for a very long time, okay? So what we're going to do from this position of slouching, just gradually push towards the front, up to where you can tolerate, especially for those people who already have reversal of the natural curve or flat low back, okay? So just do it like push towards the front, the back, front, back, and you gradually just do a little bit more smaller range, and then you stop where you feel that is the most comfortable position for you, where you don't have any pain on the back, as well as the muscles on the front and then the muscles of the back makes you feel like there's an equal pull, or they're not really trying so hard to keep you in that position, okay? And like I said, that's what we call a neutral spine. It may take a while for you to find it, especially if you have already muscular imbalance. Mostly is that most of the back muscle, the low back muscles are tight, and most of the muscles here in the abdominals are weak. So it's kind of like hard to find the position. Now you may also add on exercises for that to give that mobility. Posterior pelvic tilt, anterior pelvic tilt, posterior pelvic tilt, anterior pelvic tilt. Now this one is pretty much an exercises, and the other one, as you get smaller and smaller range, is where you find the neutral spine, okay? Now the second one that I am going to show you is pretty much what I am already showing you, okay? So ideally, posture should be like this, feet flat on the floor, about 90 degrees from the ankle, from the knee, and also from the hip. But God knows who's the only person who can maintain this. I don't think, even probably if you are in the military, like straining on the back too. So what you can do, I've learned this from the last convention that I went to last year. So you're just going to push back one of your leg. Okay, that puts this side of the pelvis to go a little bit more towards the front. Okay, so this is really very good when you have the C curve of your spine. It kind of like started to create that curvature to go back into that S curve, which is the normal curvature of the spine. Then you can switch on the other side as well. The only thing really that is very important for you is that whatever you do in the front, just prevent your head from looking like this. Locked ups really are a very good example where you would look down, because it's really hard to lift that laptop up. If you can, good for you, but mostly if you're using the monitor when you're on the computer, that would be like eye level, then that would be an ideal posture for you. But with the laptop, you just kind of like reposition your pelvis, because sometimes really you can't prevent your head looking down. And then we will just do the exercises that I'm going to show to you later on in the videos to kind of like address that muscle as well that is affected here. Okay, but for now, we are just talking about positioning. Okay, now this could be a very good exercise as well, while you are typing whatever it is that you're doing, and you might kind of like switch this one here so that your pelvis will have a little bit more rocking in the opposite directions. Okay, I just thought about it right now. Okay, so it kind of like feels good. So that's why I'll just throw it out and do that exercise. Okay. Now the last one is pretty much more on the static side. Static, like you don't really have to do any movements at all. And that is with the support of something. I just use this one. I use this a lot when I'm sitting on the couch to kind of like cushion myself when I'm already starting to having this bad posture. Okay, so you could use this, or you could fold any towels or any cloth that you can find at home. And what you're going to do is just to put this here. Now, not the whole buttocks, because when you put the whole buttocks, you will still be slouching. Anyway, I will still be slouching. So if you just put like half there. If I do half, even if I put my feet like flat together, I feel that my pelvis is being pushed a little bit more to the front or forward. Okay, so this one you could actually go on like forever, whatever it is that you are doing, and then just adjust it from time to time. Those positionings are very important for you, that you could really apply whatever it is that you are doing, apart from the stretches that I am going to show you later on. But those are very basics. It's very doable. You don't really need tools. You don't really need whatever. You don't need to buy anything. Whatever you have at home, that's all you can do. That's all you can use as well. Okay, that ends the demonstration today. So please be aware that whatever it is that you try to correct yourself may be uncomfortable. So just go easy and just go just past the point of discomfort until your body gets used to it. I'll see you again on the next part of the series. I probably will be talking about some postural exercises. So please don't forget to subscribe and have a nice day.